Good morning, and thank you very much for joining us today. Today, the opioid strategy, as you know, is a 5-pillar integrated response to the opioid crisis. And with the current COVID-19 pandemic, we find ourselves dealing with a dual crisis with compounding harm to health, safety, and security to our communities. I'm very glad today to be joined by 3 representatives from the Universal Postal Union, a collaborating partner of the UNODC Opioid Strategy and the global response to the opioid crisis, where we'll be speaking to Ms. Dawn Wilkes, Postal Security Manager, and Mr. Noor Adan, Supply Chain Coordinator, as well as Wendy Aiton, Coordinator of E-commerce and Physical Services. And today we'll be speaking about the implications of COVID-19 on postal security and efforts to interdict trafficking of synthetic drugs and synthetic opioids. So thank you very much, Dawn, Noor, and Wendy, for taking the time to speak with us today. And I'll direct the first question to Dawn. Dawn, could you tell us, please, in the context of this dual public health crisis, the opioid crisis and COVID-19 pandemic, how has this affected or influenced or implicated postal services and efforts to secure mail operations and to disrupt trafficking in synthetic drugs, including synthetic opioids?
Sure. As you know, the designated postal operators around the world are facing multiple concurrent crises that affect their operations and the customers that they serve. The COVID-19 pandemic has seen large-scale interruptions in the principal modalities to transit. The implementation of social distancing has become the norm for all. The initial focus for postal operators and governments has been rightly targeted towards safety. During times of crises, there are always those who attempt to take advantage of the situation. One of the primary competing priorities, which is deviating focus from the opioid crisis, is the plethora of fraudulent COVID-19 items, some of which are being transported in the postal supply chain, from test kits to supposed cures, as well as financial swindles. These have all diverted focus and resources towards these immediate threats and away from the opioid crisis.
Thank you so much, Dawn, for painting the picture of the challenges. And Noor, if I can just ask you, how has the UPU responded to this complex situation, and how is it responding to securing postal services and personnel from drug trafficking in midst of this global public health pandemic, and how it interlinks with the opioid crisis?
Thank you, Asma. During this global pandemic, the UPU has responded fast by ensuring that the staff of the International Bureau was able to work remotely and remain safe to ensure there is maximum capacity for response and support to our 192 member countries. We have initiated a COVID-19 resource database to meet the various needs of our member countries and their designated operators in terms of accessibility and the relevance of the information provided, to preserve operational continuity and the sustainability of the global postal network. Together with our stakeholders, we are building capacity in the areas impacted by the pandemic, such as transport, to ensure movement of mail through air cargo, trains, and ships. Jointly with the World Customs Organization, we are increasing the understanding of these new transit routes. The UPU continues to maintain cooperation with organizations such as UNODC and INCB to communicate to our members identified trends that relate to the opioid crisis. Thank you.
Thank you so much, Noor, for that. And perhaps, Wendy, more specifically, can you tell us how member states who need support in strengthening their postal security during this COVID-19 pandemic and the simultaneous opioid crisis, how can they benefit from the UPU and the different programs and supports that are available through the UPU?
So thanks for the question. So even during the ongoing crisis, the safety and the security of the postal network is critical. So the UPU continues to support our member countries mainly in 3 ways. The first way is that the UPU monitors disruptions in the supply chain caused by the pandemic and identifies solutions to mitigate these impacts. By monitoring the disruptions, it enables us to consolidate best practices amongst posts, and that could help determine new or improved security standards. Secondly, we're supporting our member countries with the implementation of electronic advanced data. So they'll be capable of exchanging electronic advance data when this becomes mandatory for all postal items containing goods on the 1st of January of next year. And thirdly, the UPU continues to provide security certification for countries complying with all of the requirements. We also provide online security training. And lastly, through our regional coordinators, we continue to ensure the necessary knowledge share between our members.
Thank you so much, Wendy. And once again, I'll take this opportunity to say thank you very much, Don Wilkes, Noor Adan, and Wendy Aiton from the UPU for your time, and also for the UPU's collaboration with the opioid strategy and with supporting member states to help predict, prevent, and protect against synthetic drugs and synthetic opioids. This is indeed a very challenging time for everyone, and we hope to very soon see you on the other side of the pandemic. But I also wanted to express a very heartfelt thank you to the postal workers and the postal officers around the world who are risking their lives every day to ensure that there is a non-disruption of the postal supply chain, which we all very much depend on, especially during this time of physical distancing. So once again, thank you so much for your time in speaking with us today and for the UPU's collaboration with the UNODC Opioid Strategy.
Thank you.
Thank you.